Here at Westside-Medical. Today we're going to talk about some tricks we use in my clinic here to work with AC joint pain. Now the AC joint is where the clavicle, right through here, meets the acromion process of the scapula. That transition area right through there is where like that shoulder blade kind of rotates. Because the shoulder blade itself doesn't have a joint, it's just a blade anchored by the muscle, and this is kind of the pivot point where the AC joint is. And so the first thing we want to work on is we want to stretch the pec minor. And the pec minor is actually, here's your pec major. The pec minor is actually underneath it here on the underside. And it ties in to the coracoid process of the scapula. So what happens is when that gets tight, it actually rotates the shoulder blade up. It's going to add the constant compression here. So we like to use like a baseball, lacrosse ball, whatever, and you're going to put it against the wall, and you're kind of going to sink it up in here. It's going to pull that shoulder blade up and back. And that's going to kind of help release that pec minor. Like I said, once you release that pec minor, the shoulder blade is going to kind of sink back and take some of the pressure off the AC joint. Now the next step is we want to work the capsule itself. The capsule is some connective tissue right where the clavicle and the AC joint connect. And that can also get tight. You can have adhesions there that affects the biomechanics, and that can pull and cause some osteoarthritis. So you can take like a roller or even like a baseball, something like this. You're going to get the AC joint, if you can see that, on the wall here, and you can seesaw the arm back and forth, and that's kind of like taking that AC joint and kind of rotating it like this and kind of work on that capsule. You can also kind of hook it and just kind of pull that arm behind your back. So you're going to compress that AC joint, you're going to pull that arm back, and it's going to pull those adhesions out of that capsule. Next thing we want to work on is the overall range of motion of this shoulder blade and the shoulder complex. We want to stretch it in internal and external rotation. So how we do that is we take a band, get these at a Westside barbell, hook it up, slide your wrist in here. The reason why you slide your wrist as opposed to grabbing it, when you put your wrist in there, it allows your whole arm to relax. So you're not contracting those forearm muscles. So you're going to work external rotation first. Just going to let that shoulder blade sink, rotate behind the head. And you want to hang out here at least 2 minutes to make that tissue change. Just kind of, stretch out this lat and kind of pull forward like this. But also hit that pec minor that we talked about a little bit also. So that's external rotation of the shoulder. Now that we can work internal, you want to drop this down to probably about waist level. And you're going to stretch that internal rotation like that. And it's going to stretch all these tissues. It's going to stretch that supraspinatus muscle, the top rotator cuff muscle, as well as just kind of rotate that AC joint and stretch open that capsule on the AC joint there. So once again, you want to hold for 2 minutes. Now that we've worked the biomechanics from like a stretching standpoint as well as clearing out the adhesions, now we want to kind of pump the area to work out the inflammation and fire the muscles around it. So the best way I've found to do it is you want to take a really light band. You're going to work all ranges of motion above the head. So what I mean by that is you're going to start off and you're going to just start pulling back. Just like this. And that's going to activate some of the shoulder muscles and pump the inflammation out of the AC joint. So first you're going to go, posterior, and you're going to work it this way. And you can probably about, do a set of 10 each. So you're going to do like 2 sets total of all the exercises. So you're going to work this way, pulling it laterally. Then you come forward here. This is like my favorite one product because it really helps pull that shoulder blade back too as well as the traction AC joint at the same time. So you want to do 10 of these, and then you turn around like this, and you pull medially. Good. So like I said, do a set of 10, all 4 ranges of motion, do maybe 2-3 sets. So hopefully that helps you guys. Visit us at Westside-Medical.com.